you have to go to college?
Yes.
You have to go to some college.
Yes.
You don't have to go to all college. You can actually become a CNA before you even go to college, a certified nurse assistant. You can be that before you go to college. Okay? How about a physical therapist?
No.
Actually, yes. Veterinarian?
No. Yes.
Got to go to college to be a veterinarian. That's kind of hard to take care of the animals and not have to go to college. Because you got to learn
How to.
You got to learn the science. Okay? How about to be a dentist?
Yes.
Yeah, that's pretty obvious, huh? All right. You ain't got to pick on me. How about an optometrist?
Yes. Yes. All of them.
Actually, that's a plus minus. You can actually go to a 2-year school and get your optometry degree. Okay? How about an X-ray tech?
Yes.
No, you can actually go to community college, have 2-year college, and get a degree to be an X-ray tech. How about a pharmacist?
Yes.
Pharmacists, you definitely have to go to college. A legal drug dealer, that's correct. And how about a physician assistant?
Yes.
Actually,
No.
yes. Okay. Now, let's go back and figure out how many years does it take to do each. How about that? So we already know it took 15 years. I almost said forever. I didn't mean that. I don't want to discourage you. But it takes a long time to be a doctor. You got to be dedicated to become that. To become a nurse, you can do a 2-year degree, or you can do a 4-year degree. All right? Physical therapist, you go to college and you can do a 2-year program to become a physical therapist. Yes, sir.
So you said for those people do 2 years. So what will happen before you? You'll go to a better hospital or something?
Yes and no. Depending upon what you want to do with that degree at the end, because you don't have to take a nursing degree and only go work with patients. You can take a nursing degree. In fact, I have one of my boys who I met when he was a freshman in college. He came and he shadowed me in my office, and I worked with him for a whole summer. And after that summer, he decided he didn't want to be a doctor, which was fine, because what he found was that his love was really wanting to be a nurse. He wanted to be a nurse. So I encouraged him to become a nurse. And after 4 years at North Carolina Central, he graduated with his nursing degree. All right? He got a job at Duke. But then a month after graduating from his nursing program. But within 3 months of having that job at Duke, he applied for another job at a pharmaceutical company. And he got it. So now he works as a nurse liaison with the pharmaceutical company. Rather than seeing patients, he works on working with the community to discuss issues with the community from the nursing perspective with people in the community. Yes, ma'am. Great question. In the past, that may have been true. But President Obama put in legislation in the last 2 years that calls for equal pay for equal jobs. Used to be a time that women earned 75 cents for every dollar that a man earned. That's not the case anymore. Women earn the same amount for the same work that a man does. Don't ask me why they thought that should have been the case back in the day, because I have no idea. Yes, sir.
Can you explain the difference between a doctor and a nurse?
Between a what?
Doctor and a nurse.
Okay. So, the difference between a doctor and a nurse is that the doctor comes in and sees the patient and then comes out and writes orders that the nurse then will take the orders and then go work with the patient on what the doctor wants to get done. Okay? So the doctor is kind of like the person that has the oversight, the ultimate responsibility. Because if something goes wrong with that patient, the doctor is the person that gets in trouble. Okay?
I thought